Health literacy impacts most everyday health decisions, from over-the-counter medication use, health screening choices, medical insurance selection, and especially decisions about personal and family disease treatments are all influenced by the availability and clarity of health information. Health literacy is a big concern since experts and researchers say that improving the nation's health is largely influenced by understanding health information. The workshop today will focus on patient-centered care by improving health communication at Brownville. By working together as a team, we will improve patient health outcomes by building an infrastructure to sustain health literacy efforts. Now, the key question is, what exactly is health literacy? It's the ability to obtain information, understand it, and use it in a way that can help you make health decisions that fit your needs. Now, allow me to rephrase this statement. Health literacy requires several skills: reading and listening, as well as analytical and decision making, then the ability to apply these skills together when it comes to health situations. Now, what's so significant about health literacy? The problem is 9 out of 10 adults struggle to understand materials that are commonly used in health systems. Even people with these health literacy skills face issues when they navigate the healthcare system. Filling out forms and finding providers and services can be challenging. Practicing self-care and chronic disease management can even be greater. Let's say people with poor health literacy may find themselves overwhelmed by a health condition because of their abilities and skills don't match up to the demands on them, or the complexity of the current healthcare system. Well, low health literacy doesn't just affect individuals. It affects the economy, it affects Brownville Memorial Hospital, and later we'll discuss the implications. But today we will review strategies and communication theories that will give you a deeper knowledge on health literacy. The health literacy development goals for this year are clear communications with patients and proper utilization of health materials. These two goals are important because they set the precedents for health outcomes for our patients. Now, it is equally important for healthcare teams to have the communication skills to provide health information that is easily understood by patients, families, and caregivers. In this sense, health literacy is a shared function and responsibility. The patient must communicate effectively with us, and in turn, we are committed to providing the education and support that patients need to understand their illnesses and treatment decisions. So, we'll go over these bullet points far as how it relates to communication with patients. Improve patient safety. Health literacy can boost patient outcomes and safety, but we need to ask the right questions to assess how much patients know about their medical conditions. Ask open-ended questions that requires dialogue instead of a question that can be answered with a simple yes or no. This will provide a glimpse into their situations at home. Furthermore, with open-ended questions, you're able to know whether the person understands their health situation and what kind of resources they can have, what kind of resources they have access to. This will assist you in determining your action plan with your patients. Decrease chronic conditions. Study shows an improvement in health literacy can can result in healthy behavior changes, and patients with chronic diseases need support and information in order to be effective managers of their health. Fewer hospital visits. It's very important for us to communicate with our patients effectively. We need to provide clear, easily understood, actionable instructions. Patients unable to adequately understand are twice as likely to experience a preventable emergency room visit, resulting in hospitalization. Therefore, we need to focus on keeping information simple. Lower mortality rates. Studies show a lower level of health literacy can increase your risk for death when suffering from an acute and chronic disease. This is correlated to patients not clearly understanding the implications for diagnosis and the lack of knowledge of how to care for their condition. Lower healthcare cost. This relates to repeated visits to medical offices and hospitals. Again, what does this mean? And how does it relate to health literacy? We must communicate. And better management of chronic diseases. Health literacy influences chronic disease management. Before they leave the office, we need to communicate about self-care, but also about key community and online resources. Now that we receive the need for improved health literacy and communication, I would like to share with you a few tools or principles to put in your arsenal, if you will. It's called the Teach Back method. Comprehension is confirmed when patients explain in their own words what information has been relayed. When using this method, remember to ask questions throughout your interactions with patients. This way, they have time to retain the information and they won't be overwhelmed. Some examples of teach back phrases are, how many times a day do you take your medicine? Or when should you take your glucose reading? Specific implementation of the teach back strategy will depend on the individual characteristics of your department. Another concept is plain language. It ensures material is written without jargon and words are simplified. It's writing that people can understand. It ensures that people can easily grasp your message the first time they read it. The main principle is to use familiar terms. Now on to health materials and how do we use them. Health material is very important because it communicates modes of treatment and assists in making informed decisions. It's an educational tool for patients, and oftentimes they share the information learned with family and friends. It can be used as a reminder for appointments and health directives. Also, it is a good way to start a conversation with your patients. It creates dialogue and trust. Lastly, health materials build confidence for the patient. You are giving them something to refer to during times of uncertainty. And remember, many people outside of the medical profession don't understand billing, medical terminology, and concepts. So, therefore, before you hand out any literature, try to get to know your audience. Ask yourself, will the patient read a brochure or letter? Would a video or web link work better? People respond to health materials that are targeted to their demographics. That being said, make sure you use brochures that are culturally sensitive and written in plain English. This main concept of plain English is to ensure materials is written without jargon and words that are simplified. Before we start our exercise, I want to briefly review the concept of health literacy. It is a multifaceted concept. It's based upon many factors. To communicate with your patient successfully, you should address these factors. You should communicate in plain language. The reading level of the average adult is at 7th to 8th grade level. And you must create dialogue. According to the National Institutes of Health, health literacy skills are needed for dialogue and discussion. Reading health information and interpreting charts, making decisions, these are important to your patients. You should get to know their values and social determinants. These two factors influences the interpretation of medical information. Therefore, try to be aware if you can, your patient's background. And lastly, educate your patients in health matters and best practices. It is the foundation for increasing health literacy, and I can't stress enough, utilize the Teach Back method. Circling back around to the areas of focus at Brownville, clear communication and the use of literature. We're going to start a small group exercise. Now, the goal of this activity is to demonstrate the mastery of clear communication and the use of literature to improve patient health literacy. After I explain the instructions, please take a card which has a number on it, and pass it around. Afterwards, find the individuals who have the same number as you. There should be 4 to a group. Each group will have a different scenario to role play. Within your group, identify the character you will play. The key to the success of this activity is to keep in mind the execution of plain language and teach back concepts. After the completion of role play, I want everyone in your assigned group to take notes and evaluate the interactions. Key questions of discussion should be: did you effectively assist the patient in reviewing their health needs? What key principles did you use to bridge the gap in health literacy? What terms did you use in explaining directives that may be otherwise complicated to the patient? And how did you assess the patient's health literacy? You will have 30 minutes to complete this exercise. Afterwards, we will return to our seats and end with discussing takeaways from the activity. Now, within your role play, there will be a doctor, nurse, pharmacist, and patient. And the doctor will review the diagnosis and prescribe prescription. The nurse will review discharge summary. Pharmacist will review medication. And the patient will ask questions of concern regarding diagnosis and medication. The breakout session will be for 30 minutes, as I stated before, and also I will provide materials to each group, and it will be a discharge summary, sample medicine bottles, medical brochure, pens, and paper. Now, also within your groups, I want you to remember during your role play to execute clear communication. And the way that you will do it is through plain language, using the teach back method, avoiding medical jargon, explanation of problem, treatment, and relevance to health. You should elicit questions from patients that can't be answered with a no. Speak slowly and clearly. Utilize cultural respect. Use appropriate health materials. Gauge understanding through conversational engagement. And address and anticipate navigational areas. Now that you have completed your group activity, let's answer some of these questions. What have you learned from today's role play? Were there any identified challenges in the execution of described objectives? What strengths or weaknesses did you uncover? What can be further explored to promote health literacy at Brownville Memorial Hospital? And did you discover new concepts or verbiage during the workshop? Please remember, it's relevant that the level of health literacy of a patient is the single most important indicator of health status. It directly impacts patients' adherence to treatment regimens and health outcomes. Point of action to take when you leave today is when you communicate discharge, treatments, medication, and appointments, use the teach-back method in plain language. This will ensure that all of our patients will have a seamless experience at Brownville. And also, this will broaden their trust and strengthen their relationship with our hospital.